Etoposide Phosphate Solution, Reconstituted, Recon Soln, is a medication used to treat testicular cancer and certain forms of lung cancer, such as small cell lung cancer. It works by slowing the growth of cancer cells. It is important to take this medication as prescribed by your doctor. The daily dosage and optimal timing will depend on your specific medical condition and should be discussed with your healthcare provider. This medication is administered slowly into a vein by a healthcare professional, as prescribed by your doctor. Typically, it is given every day or every other day for a total of 3 to 5 doses, and this cycle may be repeated every 3 to 4 weeks. It's important to note that this medication can cause low blood pressure. If you feel dizzy, be sure to inform your doctor or healthcare professional. They may need to adjust the injection or slow down the administration. The dosage of this medication is determined by your medical condition, body size, and how you respond to the treatment. Your doctor will regularly check your blood counts to ensure you can continue with the next cycle. It's crucial to attend all of your scheduled medical and lab appointments to monitor your progress. Common side effects of Etoposide Phosphate Solution, Reconstituted, Recon Soln, may include nausea, vomiting, diarrhea, dizziness, tiredness, weakness, changes in taste, loss of appetite, and pain/redness at the injection site. Your doctor may prescribe medication to help with nausea and vomiting. It's recommended to eat several small meals, avoid eating before treatment, and limit activity to help lessen these effects. If you experience any of these side effects, be sure to inform your doctor or pharmacist. Temporary hair loss may occur, but normal hair growth should return after treatment. Pain or sores in the mouth and throat may also occur, so it's important to brush your teeth carefully, avoid using mouthwash with alcohol, rinse your mouth often with cool water mixed with baking soda or salt, and eat soft, moist foods. It's important to note that this medication may cause serious side effects, but your doctor has prescribed it because they believe the benefits outweigh the risks. Be sure to tell your doctor right away if you experience numbness/tingling in your arms or legs, vision changes, eye pain, stomach/abdominal pain, yellowing of the eyes or skin, difficult swallowing, or swelling of your veins. Etoposide may lower your ability to fight infections, so be cautious and report any signs of infection to your doctor, such as a sore throat that doesn't go away, fever, chills, or cough. It's also important to be aware that while this medication may be used to treat certain conditions, it may rarely cause acute leukemia. If you have any concerns, consult your doctor for more information. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, trouble breathing, fast heartbeat, or seizures, seek medical help immediately. And remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. If you are taking Etoposide Phosphate Solution, Reconstituted, Recon Soln, be aware that it may cause severe blood and bone marrow problems, leading to low red blood cells, white blood cells, and platelets. This can make it harder for your body to stop bleeding or fight off infections. If you experience unusual tiredness, signs of infection like a persistent sore throat, fever, or chills, or easy bruising or bleeding such as black stools or bloody vomit, make sure to notify your doctor right away. It's important to keep an eye out for these symptoms and seek medical attention promptly if they occur. Before using Etoposide Phosphate Solution, Reconstituted, Recon Soln, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. Also, discuss your medical history, including any blood, liver, or kidney problems, as well as any previous radiation or chemotherapy treatments. It's important to be cautious when using etoposide, as it can make you more susceptible to infections or worsen existing ones. Avoid close contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. Additionally, be mindful of activities that could result in injury, as etoposide may increase your risk of bleeding. It may also cause dizziness, so avoid alcohol and marijuana, as they can intensify this effect. If you are planning to have surgery, inform your doctor about all the medications and products you are using. This is important for both children and older adults, as they may be more sensitive to the side effects of etoposide. Furthermore, it's crucial to discuss the impact of etoposide on fertility with your doctor, especially if you are pregnant, planning to become pregnant, or breastfeeding. This medication can harm an unborn baby and may pass into breast milk, so reliable forms of birth control are recommended for both men and women during and after treatment. If pregnancy occurs, speak to your doctor immediately about the risks and benefits of continuing the medication. When taking Etoposide Phosphate Solution, Reconstituted, it's important to be aware of potential drug interactions. Interactions with other medications can affect how well Etoposide Phosphate Solution works or increase the risk of serious side effects. To minimize these risks, it's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This can help ensure the safe and effective use of Etoposide Phosphate Solution. If someone has taken too much Etoposide Phosphate Solution and is experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. During your treatment with Etoposide Phosphate Solution, your doctor may require you to undergo lab tests and medical checkups, such as complete blood count and kidney/liver function tests. It's important to attend all scheduled medical and lab appointments. Make sure to consult your doctor for more information about these tests. Remember, it's crucial to take each dose of this medication on time. If you happen to miss a dose, make sure to consult your doctor or pharmacist immediately to establish a new dosing schedule. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly dispose of the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.